Great, thanks everyone. And given we're short of time, I'm going to leap straight in and introduce the panel that's with me this morning. So firstly, to my left is Dr. Helen Petousis-Harris, now a very renowned, well-known vaccinologist, often in the media speaking on COVID matters. She'll have some great insights this morning. Beside her is Steffan Crausaz, who is currently the CEO of Tamaki Health, which is, I think, the largest independent primary healthcare provider in New Zealand. But also, interestingly, Steffan was the previous CEO of Pharmac, and I think we'll have some very interesting insights from both those roles. And beside Steffan is Fiona Michel, who's working on secondment from Vector in the Ministry of Health team. And amongst her responsibilities, she's responsible for building the vaccination workforce to deliver this vaccine program. So again, we'll have some very interesting insights. I thought I'd start with just a few of my observations, having worked closely with government and seen how this vaccine program is gearing up. Much of the work behind the scenes, although with Fiona here, we'll get a little bit more insight this morning. You know, if you think back to globally, we started implementing or seeing vaccines implemented in the UK back in mid-December, so 6 months ago now. And if you look at what's happening around the world, notwithstanding the progress being made, I don't think there's any country that's got much further than about 60% vaccinated. And that in itself presents a real challenge to us. If we want to see our borders opening, then as the Prime Minister alluded to and other speakers this morning, the success of our vaccination program, the level of penetration that we get into the population is going to be absolutely key. It seems to be hard to pin anyone down on what level of penetration we actually need to get to. Hopefully we'll get some more insight on that this morning. But if you take out, if we assume on the positive side, the Prime Minister mentioned we may be vaccinating down to age 12. There's still 15% of the population under the age of 12, so that takes us to 85% of everyone got vaccinated. I've seen figures suggesting 75 to 80% need to be vaccinated if we're going to get anywhere near a level of population immunity, which pretty much means everyone that's eligible is going to have to get vaccinated if we want to return to the sorts of freedoms I think we're all hoping for. So on that note, I was going to open with a question to Helen. Just help us understand how big a challenge this vaccination program is in the context of flu vaccines and other programs that we're all familiar with. How much bigger scale does this represent?
It's enormous. I think, we deliver a vast number of vaccines every year. We vaccinate our birth cohort each year. We deliver, last year, I think it was about 1.7 million doses of flu vaccine. But we have the systems and processes in place, those established at the infrastructure in which to do that. On this occasion, we're wanting to vaccinate our entire population, and at the moment we're vaccinating them outside all of those existing systems. So we're talking about additional infrastructure and systems to actually achieve that at the moment. Of course, that's going to improve as we ramp this up, and we also move into delivering this within some of our existing infrastructure. But that's a huge undertaking. The most people we've ever, I think the biggest effort to date was the Men's B program about 15 years ago, where we vaccinated 1 million, and we did that over a much longer period of time.
Fiona, maybe if I pass to you, kind of as a business person, I always like to start from the customer and work back in. So if we go to the interface point where we're actually going to be jabbing people, what's that infrastructure look like? I mean, how many vaccinators do we need? How many points of vaccination? I mean, it sounds like I see a question on the screen saying, how come we haven't got it all finished yet? So how big is that? What's that actually entail?
Yes, I always remind people when they ask those sorts of questions, how long does it take to implement a new system in any normal business? We've been moving at amazing rates. And we've got the fortunate situation that we're not in an outbreak. So if we compare ourselves with other countries, there's a lot of corners being cut in order to deal with things because the outbreak's more of an issue. Here we've got the opportunity to really, as much as possible, do things right and make sure it's a sustainable move forward kind of position. So for us, we're kind of calculating on needing around about the 6,500 vaccinators. We don't have doctors, nurses and pharmacists sitting at home waiting to be called up to do this. New Zealand utilises all its skill set in those spaces. So we're having to call on a whole variety of different people and people who have been in the system and perhaps work in different places now to join the program. At the peak of the program, we're going to have hundreds of sites vaccinating across New Zealand, many hundreds of sites vaccinating everything from GPs through to very large events. And so we're building steadily towards that, both because we can and because we're needing to build that infrastructure, as Helen said, to be ready to do it well, so that the customer experience as such is as good as it can be in this context.
And what's your level of confidence as you sit here today and you look at what lies ahead, and our ambition is to get everyone that wants to be vaccinated by the end of the year. Is that looking feasible from where you sit in the midst of the program, in the hot seat at the moment?
Absolutely. Well, I mean, that's absolutely what we're working towards. That's our goal. And, our view is that we're on track for that goal, but we're going to use the whole time to get there.
Yeah. Steffan, you've got a very, very large patient database across your clinics. What's your sense about the willingness of people to be vaccinated and that interface point of whether we can convince people to step up and do what we're going to need them to do if we're going to get the level of population immunity to move us forward?
Yeah, I mean, I think there are four categories really of people in terms of their view around the vaccine. There'll be a group of people that are absolutely keen to get it as soon as they possibly can. There's going to be a group that will go along with the flow, turn up when they're asked to. There'll be some people that are a bit hesitant, and then there will be people who just won't receive a vaccine at all for various reasons. And so probably the initial challenge is going to be the first group, because that demand is going to be really quite substantial and potentially overwhelming for the system. And we've seen some of that already in the last few days with the vaccination centres, with long queues and so forth. And I think we probably expect to see that continue. The second group, they want to be vaccinated. They'll go with the program. The third group, I think ultimately most of those will come along. They're watching and waiting, and we'll see from other people's experiences, and that's a legitimate choice that some people will make. And then the fourth group is going to be the difficult one. And that group is always a challenging group, and as Dr. Bloomfield has said in the last couple of days, there are some pockets around the country where we know that can be a particular challenge.
Maybe if I'd flip back to you, Fiona, just with a follow-up question on what Steffan's just mentioned. Now, if you put your vector hat back on for a moment and think about the level of encouragement potentially that you'd want to use to get your employees to participate in the program, your employees, their families, and so on. Where do you think those boundaries lie? How firmly should we be pushing into encouraging versus clearly you don't want to force people, but at the same time you don't want to let those people that are hesitant slip through the system if a little bit of encouragement will get them to step up and be jabbed.
Yeah, no, look, I mean, I think most employers will share information about what's going on in the community in a range of ways. And I think as employers, we have no difficulty in sharing good, legitimate, factual information with our employees for them to make their own minds up. The opportunity for employers is if their employees want to be vaccinated, is to enable that, to make that easy for them to do so. So, you know, there's a difference between demanding somebody is vaccinated and in New Zealand you can't do that in most jobs, versus kind of ignoring it and making it hard so employees don't know what their options are. You know, we are an environment where all employers act as a bit of a liaison with things going on, and this is no different. But it's about sticking to the facts and allowing employees to make their own minds up.
I see a question that's come up, Helen, about whether we should be developing the ability to manufacture these vaccines here in New Zealand. Is that a feasible thing for New Zealand to be thinking about in terms of the scale of opportunity we would have here?
I do. I think there's an opportunity there for us. I guess in terms of a little bit of insurance into the future, but also to the Pacific. And there are some types of vaccines I think would lend themselves to that. Perhaps the plug and play type vaccines, like the viral vectors and the mRNA vaccines, might perhaps be an opportunity here. So I'd be keen to see that progress.
One of the key data points on our ability to open the border seems to be learning more about the effectiveness of the vaccine in terms of stopping transmission of the virus within the population. We're getting good data about it, how effective it is in stopping me from getting sick. When do you think we'll have greater clarity on that key data point to start informing our ability to relax borders, particularly for the point that the Prime Minister made in terms of allowing people that are vaccinated to come in without quite the same onerous MIQ requirements?
I think for the vaccine that we're using, the Pfizer vaccine, which is looking remarkable, I think we're really getting that data. We've got enough data to know that this vaccine prevents onward transmission. The exact point estimate, I guess, is a little bit harder to pin down, because these things you learn in the real world and with real people and all those dynamics that go on there, it gets a little dirty, if you like. But it's very clear that it does. And in my experience, but by and large, the overall impact or the overall performance of vaccines often exceeds the estimates that you place on it based on the type of data you get from the trials. So, not always, but it only becomes apparent, after you start getting the experience. At the moment, I think I would be very optimistic.
And then flowing on from that, talking about this risk that we see mutations and variants that force us to have to adapt the vaccine and so on. What does experience and history and observation of this virus tell us about the speed of which that is likely to happen? Are we looking at annual vaccination programs? Do we not know that enough information to determine that yet? Is it every 2 years? Do you have any sense that you can give us on that?
I think that the current situation, really peaking around the world with the number of cases, and the more cases, the more pressure it puts on potential of these variants popping up. As we dampen that down, that risk will go down. So I imagine that we may need to come along with a adapted vaccine and second-gen vaccines. But I don't see that it's likely we're going to have to make this an annual thing. I think once we've got this pandemic under control, it may be perhaps periodic, maybe every few years or something like that. Hard to know.
Steffan, if I come back to you, I'm interested that the success of this vaccine rollout program clearly is going to have to be a collaboration between Ministry of Health, DHBs, primary healthcare providers, the business community at large. Given you're one of the largest scale players outside of government, how's that relationship working at this stage of the program, and how are you feeling about that?
Yeah, look, I think the big thing for the rollout is going to be when general practices and maybe pharmacies are able to be vaccination centres. The scale is enormous. It's 5 times bigger than the annual flu campaign. So if we think about working backwards, 10 million vaccines, 180 days to do it. Everyone can jump on their calculator and work out how many that is a day. I think it's about 40,000. It's just a huge program, and so there's been an absolute necessity to use sites. I think what would be helpful for GPs and our company would be just a bit more visibility around what's likely to happen, even though we acknowledge there's uncertainty, likely to happen in future. And the reason for that is it just reduces the number of scenarios we have to plan for. It has been the case that it's been quite unclear about how the program would roll out, and so as a business we're having to plan for a lot of different scenarios, incur costs and so forth in doing so. So a bit more visibility would help. I think the recent announcements around rollout to general practice, in a sense, was a bit of a surprise, but a welcome one. We're looking forward to doing that. We can help, and certainly our teams in our clinics want to help, and we're up for that. Yep.
Fiona, I'll come to you with a similar question in a moment, but Steffan, just before we leave you, putting your old Pharmac hat on for a moment, what do you think is the risk or the confidence we should have in the vaccine arriving when we expect it to arrive? We're obviously expecting significant deliveries through July, August, September, October. Is that likely to happen as projected, or do these things typically kind of arrive late? Is there risk that someone else grabs our supply and it gets diverted to another country? I know you're not in the hot seat seeing the visibility of that, but what would be your expectation?
Yeah, it's a bit of an old and worn out hat.
Yeah.
So it's a very interesting vaccine that we're using, and the manufacturing process is interesting too. Pfizer's a very reliable and good supplier. The supply chains generally work extremely well. This is a new manufacturing process, but they've been scaling up. They've got new sites. They've got new bulk production facilities. I'd be reasonably confident that the forecasts that they're giving and their ability to deliver would be right. We just don't have the visibility, I suppose, of the end-to-end supply chain from delivery into New Zealand, then the decanting, if you like, out of the -70-degree freezers and then through the chain down to primary care, and what all of the bottlenecks are along that process. It'll be helpful to get a bit of a schema around what that actually looks like. I suspect it's not going to be vaccine delivery that's going to be the key bottleneck. It will be workforce and ability to deliver to the demand, at least initially.
So, Fiona, I'll come back to you with a similar question that I asked of Steffan. The most common comment I hear from the business community is just they're not getting enough information about what's going on. And this is not specific to vaccine, it's kind of COVID in general. They're trying to plan, they're looking for as much insight and certainty in a very uncertain world, obviously. What's your sense about, from here as we look forward to this general population rollout from July, how that level of engagement and communication with the business community here is going to increase?
Yes, and I think, probably everybody will have seen, even in recent weeks, there has been significantly increased communication. You know, there's television ads, you've probably had something in your mailbox at home and so on. And that level of communication is increasing constantly at the moment, and to the point when we get to July and August, where the general population should have a much deeper understanding of everything that's available to them. In terms of the business community, we're working directly with DHBs around their communication out to their local communities, because you'll appreciate in different parts of the country the need is different. With employers, there's the opportunity to work with some employers over time, particularly large employers. And for now, examples of that are where we're working with police and corrections, the Defence Force, all of whom have been vaccinated or are in the process of being vaccinated as part of the rollout process. With organisations where you're a private organisation, but perhaps you've got a large workforce in South Auckland, where you fit nicely into the current sequencing framework, there's the opportunity to talk to your DHB now about how we might be able to work directly with you on that. And then as we get into the general population rollout, there could be situations where employers want to work with their occupational health providers that vaccinate for flu now. And as we get down to that point, that might be more feasible. You know, as Steffan said, the vaccine, it's not like a flu vaccine. And I think a lot of people in the general population don't understand that it's a very delicate vaccine. It has to live in very controlled conditions. And on that basis, there are only certain providers right now that can support those conditions to be able to provide the vaccine. But we're learning every day, and new research comes out every day about what can be done so that the vaccine stays good and can be used. And by the time we get to that general rollout, you know, we may have much deeper flexibility than we had at the beginning of the process, where it was managed in a much more controlled way.
I'd like to turn now and focus on how we get the participation rates up as high as we can. And starting with you, Helen, you know, I hear comments from people in social circles talking to me and saying, well, you know, I'm a bit nervous, I'm thinking of having children and I'm not sure about what this could do to my fertility, or, you know, I don't want my kids to be autistic or whatever. What would be your response to those apprehensions?
I think a lot of the apprehensions will evaporate as people see their neighbours are still walking around after getting the vaccine. So I think there's definitely going to be a positive effect of seeing things are actually okay. I think we also face an enormous challenge in this space. We do have a small group who are a very active, coordinated megaphone for misinformation, and that of course is dished out across social media, and that has an impact. It doesn't turn people anti-vax, if you like, but it does raise their hesitancy, it lowers their confidence. So I think there's a lot of work to be done in that space as well. So a combination of those things is going to be really important.
Steffan, in the workplace, you know, you work in a very safety critical environment. If you have staff members in your clinics that choose not to be vaccinated, what's the implication of that for you in terms of how you can use them, deploy them, what other requirements you'll have of those people if they choose not to be vaccinated in your workplaces?
Yeah. In our environment, we're very used to, at least over the last 12 months, dealing with health and safety risk around COVID, and we've treated patients with COVID and tested and diagnosed them. So it will become a health and safety issue. There are limited non-frontline roles, and so it is likely that in the event of increasing up the alert levels while a vaccination program is underway, or while we've perhaps got people who are unvaccinated, that there may well be a health and safety requirement for differential personal protective equipment, for example, to keep everybody safe. So that's the likely direction. While we're in alert level 1 and there's no COVID in the community, then there's not a health and safety impact and no issue, but could change.
It seems, I mean, one of the interesting insights I took out of the Prime Minister's comments is this direct correlation between vaccination and freedoms in our everyday life, right? And you can think of it at a population level that says if we get a high enough level of vaccination across the population, then we'll get freedoms at a population level. But I also interpreted that was applying at an individual level as well. You know, if you're vaccinated, that will create freedoms for you that if you're non-vaccinated, you may not have those same freedoms. For example, you know, if you come across the border and you're unvaccinated, then you may require a period of isolation or whatever before you can interact with the population, whereas if you are vaccinated, then you may have a freer path across the border and so on. Is that the world that people are seeing?
Yeah, it could be to a degree, but I think the main driver of it will be the population vaccination, and the reason I would say that is that it actually only takes one case in an unvaccinated, non-immune population. I mean, this whole thing started with one case, and so if we take unnecessary risks with that, while we have a largely non-immune population, then that becomes an issue. And so, yeah, I mean, you could foresee some kind of differential, but I'd be surprised if it ends up playing out being material.
And maybe Helen, back to you. I gave a very uneducated kind of stab in the dark. What level of penetration or vaccination do we need to get it to at a population level for us to have an acceptable level of population immunity to think that we can lower some of these barriers at the border and so on?
Yeah, I think that's a really big question, and I don't think there's just a magic number, and that number can be a little dynamic, especially with you say variants that spread more easily, which comes into the equation. One of the things too that in New Zealand we don't have a natural population immunity because we've been COVID free, whereas some of these other places have had an enormous number of cases, and so they've also got the contribution of people recovered who have some immunity against COVID, as well as the vaccinated. So it all gets really complicated when you try to model it. But I think one thing for sure, we absolutely have to aim high. Don't aim for 70%. Aim for 90. Aim for 95, because you might not get there. And also we have to do this equitably. You cannot have pockets of susceptible people sitting around because that's just going to lead to problems. So that's the other point, is that you're probably better off having a lower rate equitably distributed across your population rather than a high rate with all these pockets, I suspect. Yep.
Okay, thank you. And Fiona, if I could give you the second to last word, because I was going to save the last word for myself. What are the messages you'd like to leave particularly the business audience here or any of the community leaders in terms of what they can be doing to support the success of this program as they walk out of the room here today?
Yeah, thank you. Well, look, probably just coming back to the comments I made earlier, make sure your people have access to good, reliable information about the vaccine. Where you can, enable them to have the time to be vaccinated. If you are working with our really at-risk populations, so that would be particularly a workforce of Māori and Pacific employees, then ensure particularly that you've engaged with your DHB if you've got a large workforce, to see how we might be able to work closely to make sure that they're vaccinated in that right way. If you are a healthcare provider, or you have friends and neighbours and who have clinical skills and they're interested in becoming vaccinators for this process, then we're still really welcoming additional people who either currently or previously have been clinicians to join the program as vaccinators. So we can. That can be registered through the Ministry of Health website. We have a thing called the Surge Workforce Database there, and then the Immunisation Advisory Centre is the Ministry's experts and training experts to make sure we build people's skill sets. So sharing that word is also really useful too.
Great, thank you. I was going to conclude with three comments. Firstly, I think listening to the Prime Minister this morning, that's probably the most optimistic I've heard here in 12 months of working alongside her on this. So I was really encouraged by that. The only counterfactual to that, last week I heard both Dr. Fauci from the US and the Director General of the World Health Organization describe this next phase we're moving into as the most risky phase of the whole pandemic, and driven by the fact that their fear that everyone starts to let their guard down as these vaccination programs roll out before the vaccination programs are sufficiently advanced to create the level of protection that society needs. And then the third message from what I heard here today is our freedoms are inextricably tied to our ability to get deep penetration of these vaccines through our population. And that fundamentally means we need everyone that's eligible to be vaccinated to get vaccinated. And I think the more people that are sending that message across New Zealand, the greater the hope that we'll have success with this program, which should be the ambition for all of us. So thank you, all three of you, for your contribution today. I think it's great to be able to have these insights on the stage. We're all craving information every day, and particularly I think Fiona, to have the veil being lifted a little from the Ministry of Health and see that information flow in a forum like this is incredibly valuable, but thank you to everyone. Thank you.